Now, more patients are getting hospital-type care at homes with the expansion of a pilot program that covers all public acute hospitals. It now includes specialist care like gynaecology and rehab and treatments for children. Nearly 1,000 more patients are expected to benefit. Now, this will help ease hospital loads to allow space for more urgent cases. Sherilyn Sia reports.
Hi, Suyen. How are you feeling today?
I'm quite good.
13-year-old Chi Sui Yan's recovery at home is a much-needed respite. She spent 5 days at KK Women's and Children's Hospital with a bout of dengue fever before going home.
My daughter, definitely, she's very happy. She says she can sleep very well because no interruption, less interruption if compared to the hospital. And the infection for other illness also can reduce, right, if you stay at home.
The hospital's home care program is among the 4 added to the mobile inpatient care at home scheme. With a target of 200 patients recovering at home per year, KKH says patients and parents are guided through each step to ensure that quality care is given at home.
The nurses and the program coordinator will also teach the parents how to measure the blood pressure and heart rate at home. So if the parent is able to do all this and comfortable with this, only then do we formally finalize the enrollment, and then we will send the patient home on this program. So if it's necessary, we will dispatch an ambulance to bring the patient back to hospital.
The Sengkang General Hospital also began its home services recently. It focused on the emergency department to help alleviate a bed crunch. In a month, it's had nearly 20 of its patients at home.
We started with dengue, we started with spin rhabdomyolysis, which means young patients who do the spin classes and then they end up with a lot of muscle breakdown, which is actually toxic to the kidneys. And then the third one will be the skin infections. So these patients are very stable, yet requiring significant number of hospitalization duration, which amounts to like 5 days on average.
With patients recovering at home, it will also save on costs.
There is potential for this sort of care model to reduce the hospital bill size by 20 to even up to 40%. We are also trying to be as comprehensive as possible in tracking these various cost elements. And at the same time, within the sandbox, it also affords us an opportunity to simulate mainstream financing parameters, for example, inpatient subsidies, MediSave, MediShield Life.
With the trial ending next year, transition plans are being worked out. The data collected will also be evaluated to see if the program can be scaled up as a regular medical service at hospitals.